Hello guys, today we'll talk about fluid and electrolyte management on surgical patient. It's first um, topic of big topic and first point of big topic, and I delayed it to many many parts. You need to understand that it's real big topic, and we will talk about this all mm, all your time. Okay, let's start talking. Fluid and electrolyte management is paramount to the care of surgical patient. You understand that always when we have some patients, we can help them with some kind of transfusions. And you remember that our surgery disease have disease like cholecystitis, pancreatitis, intestinal obstruction, and of course you need to understand that in all these moments, in all this disease, we need help them with transfusions. Changes in both fluid volume and electrolyte composition occur pre-operatively, intraoperatively, and post-operatively. And equivalent, we can say that equivalent is peri-operatively. Uh, of course, we need to talk about changes when we talk about response to trauma and sepsis. The sections that follow review the normal anatomy of body fluids, electrolyte composition and concentration, abnormalities and treatments, common metabolic drugs, and alternative resuscitative fluids. These concepts are discussed in relationship to management of specific surgical patients and their commonly encountered fluid and electrolyte abnormalities. Now we will talk about body fluids. When we talk about body fluids, we need to understand that our organism and organism of our patients have total body water. Water constitutes approximately 50% to 60% of total body weight. The relationship between total body weight and total body water, TBW, constant is relatively constant for an individual and is primarily a reduction of body fat. Lean tissues such as muscle, and solid organs have higher water content than fat and bone. As a result, young, lean males have a higher proportion of body weight as water than elderly or obese individuals. We have interesting clinical research. Deuterium oxide and treated water have been used in clinical research to measure TBW by indicator dilution methods. In an average young adult male, TBW accounts for 60% of total body weight, whereas in an average young adult female it is 50%. The lower percentage of TBW in females correlates with a higher percentage of adipose tissue and a lower percentage of muscle mass in most. Estimates of percentage of TBW should be adjusted downward approximately 10% to 20% for obese individuals and upward by 10% for malnourished individuals. The highest percentage of TBW is found in newborns, with approximately 80% of their total body weight comprised of water. This decreased to approximately 65% by 1 year of age and thereafter remains fairly constant. TBW is divided into three functional fluid compartments: plasma, extravascular interstitial fluid, and intracellular fluid. There you see cable about functional body fluid compartments, TBW, equivalent of total body water. Let's talk about extracellular fluids. The extracellular fluids, or ECF, and plasma and interstitial fluid together compose about 1/3 of the TBW, just 1/3. And the intracellular compartment composes the remaining 2/3. The extracellular water composes 20% of the total body weight and is divided between plasma. It's like 5% of body weight, and interstitial fluid. It is 15% of body weight. ECF is measured using indicator dilution methods. The distribution volume of natrium, bromium, and radioactive sulfate have been used to measure ECF in clinical research. Intracellular water makes up approximately 40% of an individual's total body weight, with the largest proportion in the skeletal muscle mass. ECF is measured using indicator dilution methods. The distribution volume of natrium, bromide, and radioactive sulfate have been used to measure ECF in clinical research. Measurement of the intracellular compartment is then determined indirectly by subtraction the measured ECF from the simultaneous TBW measurement. Okay, and now we will talk about composition of fluid compartments. The normal chemical composition of the body fluids compartments you can see in this table. The ECF compartment is balanced between sodium, and chloridium and bicarbonate. What is the principal anions, and sodium is cations. The intracellular fluid compartment is composed primarily of the cations potassium and magnesium, and the anions phosphate and sulfate and proteins. Proteins, sulfate, calcium, magnesium, potassium. The concentration gradient between compartments is maintained by adhesion triphosphate driven sodium potassium pumps located within the cell membranes. The composition of the plasma and interstitial fluid differs only slightly in ionic composition. The slightly higher protein content, like organic or animals, in plasma results in a higher plasma cation composition relative to the interstitial fluid, as explained by the Gibbs-Donan equilibrium equivalent. Proteins add to the osmolarity of the plasma and condition to the balance of forces that determine fluid balance across the capillary and the endothelium. Sodium, however, is confined to ECF compartment, and because of its osmotic and electrolytic properties, it remains associated with water. Therefore, sodium-containing fluids are disturbed throughout the ECF and add to the volume of both the intravascular and interstitial space. Also, the abdominals of sodium-containing fluids expands the intravascular volume. It also expands the interstitial space by approximately 3 times as much as the pain. The physiologic activity of electrolytes in solution depends on the number of particles per unit volume, millimoles per liter or millimoles per liter, the number of electric charges per unit volume, and the number of osmotically active ions per unit volume. You can see all there. The concentration of electrolytes usually is expressed in terms of the chemical combining activity or equivalence. An equivalent of an ion. It is atomic weight expressed in grams divided by the valence. The physiologic activity of electrolytes in solution depends on the number of particles per unit volume, the number of electric charges per unit volume, and the number of osmotically active ions per unit volume. The concentration of electrolytes usually is expressed in terms of the chemical combining activity or equivalence. An equivalent of an ion it is atomic weight expressed in grams derived by the valence. The movement of water across a cell membrane depends primarily on osmosis. To achieve osmotic equilibrium, water moves across a semi-permeable membranes to equalize the concentration on both sides. This movement is determined by the concentration of the um, the movement is determined by the concentration of the solutions on each side of the membrane. Osmotic pressure is measured in units of osmoles or milliosmoles that refer to the actual number of osmotically active particles. For example, 1 millimole of sodium chloride contributes to 2 milliosmoles, one from sodium and one from chloride. The principal determination of osmolarity are the concentration of sodium, glucose, and the urea, or blood urea nitrogen BUN. Calculated serum osmolarity equals to sodium plus glucose share 18 plus BUN share 2 and 8. The osmolarity of the intracellular and extracellular fluids is maintained between 2090 and 3010 m's in each compartment. Because cell membranes are permeable to water, any change in osmosis pressure is 1 permeable of water. Any change in osmotic pressure is one component is accompanied by the redistribution of water until the effective osmotic pressure between. For example, if the ECF concentration of sodium increases, there will be a net movement of water from the intracellular to the extracellular compartments. Converse, uh, Conversely, if the ECP concentration of sodium decreases, water will move into the cells. Conversely, if the ECF concentration of sodium decreases, water will move into the cells. Also, the intracellular fluid shares in losses that involve a change in concentration or composition of the ECF, and an istomic change in volume in either one of the compartments. For practical and clinical purposes, most significant gains and losses of body fluid are directly from the extracellular compartment. And for this part of topic, that's all. Thank you very much for your attention and see you soon. Bye bye.